Good morning. Good morning, everyone. We're moving right from string beans to Zika without any interstitial. I think you all know our guest today, Schuchat, who's dressed as an admiral because she is actually an admiral, is the deputy director of the CDC and one of the point people on Zika. Tony Fauci, you all know, one of the great leaders in the fight against AIDS, really one of America's most famous doctors. You and Dr. Oz, I guess, would be in the same, sort of the same category. Let's jump right in this because it's a huge subject and it's on the front page every day. Anne, could you just give us a status update on the fight? When we spoke last in late June, and you and Tony both, I asked you how far are we away from the first domestic transmission of Zika, and this is late June, and you said probably it's inevitable and probably about a month, and you were exactly right. Where are we now? Can you just give us the overview?
Sure. Yeah, and just remember, we've never had a situation before where a mosquito bite can lead to a serious birth defect, to a baby that's born without ability to walk, talk, feed themselves, or really develop normally, and a mosquito-borne disease that can be spread sexually. So this is totally new territory. Unfortunately, the virus is spreading throughout Puerto Rico. There have been thousands of travel-associated cases in the domestic U.S., and we've actually had virtually every state but one has had travel-associated cases. We have had local transmission, mosquito bite to person to mosquito to person, in South Florida in 2 small areas in the Miami-Dade area. So over the weeks ahead, we expect more of the pregnancies that are affected to come to term, and unfortunately to see babies delivered who may have very severe problems. How many pregnancies do you think
are affected?
Well, the ones that we've counted, the ones that we know of, it's about 750 in the U.S. and about 1,400 in Puerto Rico or the territories, but those are the ones that have been diagnosed, and so it's really just a matter of time before we see what will happen with those.
What percentage do you expect, what percentage of those births do you expect to be affected by Zika? Is there any way of knowing?
There have been models that have been done that say just for the one really, really terrible brain damage, microcephaly, that it may range from 1 to 13% of those infected in the first trimester, but we really are at early days. We think that there are many things besides just microcephaly that this virus can cause, and both NIH and CDC are keen to understand the full spectrum of disease that the virus can cause.
Tony, is this out of control?
No, I wouldn't say it's out of control, but I would say it's a serious problem. It's kind of difficult for the general public to get their arms around because if you take Zika as a disease in a vacuum, apart from pregnant women, it's fundamentally a relatively mild disease. 80% of the people don't know they're infected. That complicates things when you're trying to track.
So we have people in America right now who have Zika who have no idea. They think it's a flu.
Yeah, they have no idea. They're completely without symptoms. 20% who get a flu-like syndrome with a rash, fever, joints and muscle aches, and a conjunctivitis. That's the disease itself. When you put into it the issue of pregnant women, for some subset of the population, a very important subset of the population, pregnant women, it can be an overwhelmingly devastating issue. So when you say, is it out of control, as an epidemiological phenomenon, it's not out of control in the United States. It's in a very well-defined area. What we have in the United States is an interesting situation, as Ann correctly pointed out. We have thousands of travel-related cases. And the reason why Florida is having a problem is that Florida is kind of like the Grand Central Station of travelers that come from the South, from South America, Central America, the Caribbean. They get to Florida. Florida has the right climate, the right mosquitoes, all the right perfect storm to have what we're calling local transmission. Having said that, the local transmission is relatively well contained, and I'm sure Ann will tell you about, because the CDC should be congratulated with the authorities of Florida for what they've done in the Wynwood section, which was the section just north of Miami. But if you look at the situation in Florida in general, we still see every day more cases come. We're now well over 100 locally transmitted cases in Florida. Not out of control, but a serious problem.
And could you talk for a minute about a controversy that's developed at CDC over, there's a whistleblower who has claimed that the CDC is not using the right testing, the most effective means of testing. Could you talk about that, answer that charge, and then maybe both of you can talk about the difficulties of not only testing, but vaccine making, because I think that's the question that is on a lot of people's minds. When are we going to get to a vaccine? So do the
Sure.
testing issue, and then maybe both of you can handle the vaccine.
Yeah, diagnosing Zika is difficult. CDC scientists developed tests both for the nucleic acid and also for antibody, and got those out to the public health labs and to international labs. There's discussion about what's the best way to test for this and how to make the tests that we have better. And we have improved the tests that we have, and now the commercial sector is coming in to work on this as well with a number of tests that have gotten what FDA calls emergency use authorization, so people can use them even before they're commercialized. But we need much better tests, and both NIH and CDC are keen for that. Right now,
Do you think that maybe you were using the wrong testing for a while?
we are using the best tests available, but they can be much, much better. They need to be better, and we've already updated the tests that we've been using. But what we don't have yet is a test like we have for German measles or rubella, which pregnant women get tested for that every pregnancy to say, have I already had this virus? Am I immune to it? So I don't have to worry about getting it during this pregnancy. We really need that kind of test for Zika, just for peace of mind for women. Because the tests we have right now are, I have it right now, or I've had it recently, but there's a lot of false positives and not clear result from that antibody test. But you could probably expand.
Right. Vaccines. So the situation with vaccines are that Zika is a flavivirus. We have experience successfully with making vaccines against flavivirus. Yellow fever is one of the most effective vaccines we have. Japanese encephalitis is another one. Dengue, that has 4 different subsets, we have a reasonably good, not perfect vaccine. So will we get to the end game of a vaccine for Zika? The answer is you never want to be overconfident, but I feel reasonably good that we will get to that point. The real question is, when can you get there? Because vaccines take time. When you do vaccines, remember, you're vaccinating normal people. So safety is important, and proof of efficacy is important, because you don't want to have people think they're going to be protected by a vaccine that doesn't work. Having said that, there are about 5 or so vaccines that are lined up in different temporal slots, as it were, ready to go. When we were in Aspen, I mentioned to you that we were going to start a vaccine trial in phase 1 in September. We actually started it earlier. We started it on August the 2nd. We're going to finish that, 80 people. We have about 60 people on the trial now. We'll finish it November, December, and then we'll hopefully go quickly into a phase 2 efficacy trial, which interestingly will be timed exactly at the summertime in South America and the South American countries. So if there's still ongoing infections in South America, and we start the phase 2B, which asks not just is it safe, it asks does it work, we may be able to get an answer in a year and a half. So right now, what the control mechanism is mosquito control. A year or 2 from now, when we want to protect women of childbearing age and essentially the entire population, vaccine will be the ultimate answer.
Okay, a year or 2 from now is fine. What would you tell a woman in South Florida today who's thinking about getting pregnant? Would you say, don't get pregnant? Would you say, get out of Florida if you're thinking about becoming pregnant? What is the situation?
It's the decision to get pregnant is a really personal one, and everybody's different. So people need
I'd like to involve the government in that decision. Yeah.
Right, okay. So,
Not that I'm putting you on the spot or anything.
So, the most important thing is to protect yourself from mosquito bites. And if you're not trying to get pregnant, to have access to safe and effective contraception. If you are trying to get pregnant and live in an area where the virus is spreading, we do want to make sure you protect yourself as best you can from mosquitoes. And of course, talk with your healthcare provider.
Let me put you on the spot with I'll sharpen the question and make it personal. if you had a relative in South Florida, in Miami right now, who was pregnant, would you tell her to get out of Dodge?
No, what I would tell them, and this goes for a variety of issues, it's the degree of risk with which you are willing to take. If you're down there because you're in the middle of something that's very important to you professionally, if you leave, you'll lose your job. If you have to take care of children who have needs that are down there, that helps you make a decision of a risk. If you're down there, but you have a mother-in-law who lives in Maine and who is saying, come visit me, I'd love to see you, you might want to go.
Overcoming your traditional opposition to your mother-in-law, right, I get it, right. But your agency is not making recommendations at this time about people who are pregnant in Florida and the relative danger of being pregnant in Florida.
I think it's really important to remember about risk-benefit. And one of the key things we need to do is understand this virus more so we can give women better information about risk. Right now, we don't know what the chances are that if you get Zika during pregnancy, your baby will be fine versus that your baby will have tragic defects.
Correct me if I'm wrong, but there's no way to guarantee 100%
Of course not.
safety against mosquito bites.
Right, no, but there's no way to guarantee 100% a safe pregnancy. So, you know, we all do what we can to have the healthiest babies possible. And, you know, don't smoke, don't drink alcohol during pregnancy. Women work really hard to, you know, have a healthy pregnancy. Zika is just this new, terrible threat in the midst of it, but we really need to have perspective because for most people, travel to, you know, the small little geographic area that's been designated is fine. It's pregnant women we want to stay away from there, and if you live there, as Tony says, it's a balance of how you protect yourself.
You're assuming, though, that it does spread out of that one small area.
Well, right now, the Aedes aegypti mosquito that can carry this virus is in so many states, and travelers are returning from affected areas all the time. So if you're coming back from an affected area, we want you to use insect repellent for 3 weeks after you return so you don't start an outbreak where you live. We can't assume that it's not spreading elsewhere, and we want people to really use mosquito repellent.
Let's talk about mosquitoes for a second. There's another controversial approach to this, theoretical approach to this question, which is broader than just Zika, is why doesn't our species eliminate that species, Aedes aegypti mosquitoes? I wanted to just hear you out on the efficacy of that idea of genetically engineering them out of existence, and what are the environmental and ethical consequences of doing that? As medical professionals, I assume your lives would be easier if this mosquito didn't exist.
Yeah, the Aedes aegypti mosquitoes, people call it the cockroach of mosquitoes. It's really hard to get rid of. And we did have success that was announced last week in the Wynwood area where aggressive integrated mosquito control was able, we believe, to really bring down the numbers in the Wynwood area and to stop local transmission. This was with a combination of factors, but we think this 1-2 punch of aerial spraying with Nailid insecticide to kill the adult mosquitoes and with BTI to kill the baby mosquitoes or the mosquito youth. That 1-2 punch we think really helped in an unprecedented way.
Can you lift up and grapple with that?
Yeah, well,
I mean, I'm sure you're hearing that conversation.
Well, whenever people talk about genetically modified anything, there's always a segment of the population that pushes back. Understandably so, and you know, with some good reason, because you don't want to perturb the environment in an irreversible way that might have unintended consequences. But the idea of suppressing, particularly the Aedes aegypti, a mosquito, to the point where they would be infertile and not be able to procreate, to bring it way down, that can be done, at least has been shown in pilot studies, by genetically modifying the mosquito, or even another thing that isn't exactly genetic modification, where you infect mosquitoes with a bacteria called Wolbachia that prevents them from being able to transmit a number of viral infections. If you're going to do that, you've got to do a test and an environmental impact to show that you're not going to have deleterious consequences. And in fact, the FDA has already given permission for, in a controlled way, to take a look at whether or not that would be effective and what the impact would be. So I think there is a future for genetically modified.
What's your personal feeling about it?
I think we should try whatever we have at our armamentarium tools to suppress mosquitoes that are the cause of diseases such as Zika and other diseases. You will never completely, nor should you, eliminate all mosquitoes, but there's a certain subset, as Ann said. The Aedes aegypti mosquito is a bad actor. So if we were able to suppress, if not eliminate Aedes aegypti, I don't think there's going to be an environmental impact that's profound at all. I think there are so many other mosquitoes that will take their place that you won't have to worry about that. But that particular mosquito is terrible. It bites indoors, it bites outdoors, and the other thing about it is that unlike other mosquitoes, it just loves humans. It doesn't get distracted. It's not a promiscuous mosquito. It only bites humans, and that's a bad thing.
Go ahead.
I was just going to say, I think we really need research and careful studies of all of these promising approaches to mosquito control, and we need better repellents and better pesticides. So I think the idea that we've neglected this area, there's lots of room for evaluation and exploring, and we really want to see the data. So I think they're promising approaches.
Is it wrong, because I have this impression, and I think a lot of people have this impression, that what we're seeing these days is an increased velocity of outbreaks of infectious diseases, of mosquito-borne and other types of infectious disease? Is it that we know more and it's covered better, or are we entering some new phase in disease control? Chikungunya, I mean, there's endless numbers. I mean, you guys are overwhelmed, I think, half the time with new variations of horrible diseases. Answer this question in the context also of climate change, if you could.
Yeah,
Both of you should
just want to
handle
say,
this question.
we don't feel like we're overwhelmed. We feel like we're working 24/7 to stay on top of things.
That sounds like overwhelmed.
Okay, right.
You should get a break, right?
Yeah.
I mean, everybody needs a
It
little
is.
bit of a
It
break.
is true that we used to say when things get back to normal, and now we just say this
Well,
is normal.
thank you for answering
but-
my question.
Yeah.
No, but go to that.
Yeah,
Is
well,
that a thing that's just developed in our minds, or is there really an increased velocity?
No,
in
there
this?
are two things. Of course, today we know about things happening all over the world, and microcephaly might have been happening for a while without us recognizing it because it hadn't been detected in a dense population like in Brazil. But there are so many factors of the way we live and the way the world is changing that make emerging infections and spread more likely. And travel, trade, the changes in the environment that make us live much closer to animal species we never used to live near, the globalization of the food supply. So we have
What if
new
we build
threats.
a wall?
Yeah.
Just throwing it out there.
It's your turn.
It's my question.
Yeah, go ahead.
So let's get to, I think what you were asking, Jeff, is are we seeing more of it now than we did a while ago?
Right.
And the answer is, in some respects, yes. I think some of it are things that we did not note before that we're seeing now. But there are certain things when you're dealing about emerging infections. It's an interesting fact that about 70 to 75% of emerging infections are zoonotic. They are predominantly an animal infection that jumps species. We've seen that with HIV/AIDS. We see that with influenza in spades, absolutely with influenza. We've seen it with a number of others. When the human perturbs an environment, either getting close to animals, either when you're in animal farming in the Far East with ducks and pigs, you have the influenza situation. When you have travel, what happens is that you bring diseases to a population that is immunologically naive. And I think Zika is going to be a classic textbook chapter in epidemiology because it was in Africa and the Middle East, and then it worked its way by travel across the Pacific to the Yap Islands, to the French Polynesia, to Easter Island, and then it landed in the perfect storm of Brazil. And the perfect storm was a big country with a lot of mosquitoes, poor areas of the country that you don't have good prenatal care and things like that, and importantly, an immunologically naive population. The people of Brazil and the United States have never experienced Zika before. And when you have that, even though Zika is an old infection, it probably has been around forever, and it was first noted in 1947, then you had the explosion in Brazil.
And just go to this question about climate change, not only related to Zika, but more broadly. Is that a factor as we move forward in accelerating the spread of these diseases that originate in the tropics?
There are so many ways that climate change can affect insects, and insects carry a lot of different diseases. So we really need to be on alert for a lot of things we've never even thought of. I mean, even a writer like you could not have invented something as nasty and amazing as the Zika virus, but I think we have to be ready for even more surprises.
Tony?
It's a multifaceted aspect. I mean, climate change takes different forms. If you get a little bit of warmer, you can increase the range of a mosquito either geographically up and down or by elevation. That's one thing. The other thing, if you have climate changes where you have a lot of rain, weather changes, dryness, floods, all those kinds of things perturb the atmosphere that allow vectors like mosquitoes to be more efficient in their spread.
You guys are completely fascinating. I wish we can go on all day, but we can't. Thank you very, very much for doing this. We appreciate it. Thank you.